Good morning, good afternoon, and good evening, everyone. Thanks for being with us today. We're BAO Systems, and we're going to talk a little bit more about how we are continuing to support data-driven decision-making throughout the COVID response. And so the focus of today's presentation will be on a proof of concept leveraging public health data and automated machine learning for time series forecasting. Next slide. So as Cha kindly mentioned, Sam and myself will be presenting today. First, we'll go and give a brief overview of BAO Systems for those of you who are not aware of us. We'll talk about the BAO Open Data Gateway, which is enabling us to make data more easily available to many of you. And then we'll talk about public health time series data, how we've used automated machine learning to conduct some time series analysis, and then provide insights into a case study that we've been working on to look at the COVID-19 impact on essential services. Next slide. Go ahead and on the next slide. So BAO Systems, we are a company that makes high quality data available, accessible, and digestible through our combined expertise, services, and products. Our company comprises of public health practitioners, health information systems specialists, data scientists, software engineers, and system engineers. And we feel that our team, with the breadth of experience that we have, really helps us to understand the challenges that you guys are facing in your programs and how to resolve them and support you to develop impactful solutions to drive data and decision-making. Next slide. We support our partners throughout the entire data lifecycle, from defining analytic questions and strategy to point of service data collection, organizing and aligning data across information systems to advanced analytics and machine learning, so that decision makers have the data they need to improve programming. Next slide. Actually, we can go one more slide. In this digital era, numerous data sets from different sectors that are relevant to COVID-19 are already publicly available, but not easily accessible to those without a technical background in data science. For organizations and ministries of health that do have data science capacity, staff are often inundated with routine M&E requests and find it challenging to find the time to identify, curate, and prepare these data for analysis. Furthermore, in this rapidly evolving pandemic, how does one even begin to think about how data can be more broadly used to inform the COVID-19 response at the global, national, and community levels? Next slide. Our vision, we sought to address these challenges along with others through the development of our BAO Analytics platform, which we introduced briefly last year. Our platform enables analysts to easily ingest data from multiple and disparate data systems, tools, and platforms such as DHIS2, ODK, and ComCare, which is commonly being used, and with particular emphasis on DHIS2, which is being used to collect COVID surveillance data in 37 countries globally. Take these data and ingest it into a scalable data lake and data warehouse. Routine analysis can be enriched through our curated library of publicly available global data sets from often used sources, including the Demographic and Health Survey Program, WHO's Global Health Observatory, and global COVID-19 surveillance data. Co-analysis and triangulation of programmatic and global data sets enables analysts to better understand cause and effect, improving data insights that can be viewed and shared in popular BI tools. On the next slide. We wanted to enhance, like I said, we wanted to really enhance our partners' abilities to use these varied data sets for data triangulation by enabling one-click ingestion of these publicly available data sets. And I apologize, the slides look a little bit fuzzy, but what we're trying to show here are a collection of data sets that we've made available through our Open Data Gateway. We continue to identify, curate, and make available relevant data across multiple sectors, including population and demographics, health, nutrition, water and sanitation, agriculture and food security, and weather, as well as other new emerging COVID-related data sets. Ultimately, better access to these data will enable you to holistically analyze your own data and more easily answer questions such as, how did deforestation and population spread affect the emergence and resurgence of disease? What effect does differing perceptions on the severity of COVID-19 have on disease spread in community? And how can we better plan for and deliver vaccines now that they're starting to become available in more and more numbers? Just a quick note to say that making this public library of data sets was made available through to funding that we got from FCDO's COVID Action Data Challenge. And so what we are doing with these data sets is making them more widely available and available for free so that you guys can actually access the Open Data Gateway, download data sets of interest, and use that to help inform programming within your own programs and assure equitable vaccine delivery. Next slide, please. So again, this is just showing briefly some public data. This is taken from demographic and health survey data, where it can be used to help better inform your programs and identify sort of the demographic factors that might impact both COVID spread as well as vaccine delivery. Next slide. I think one of the advantages to using some of the public data is really to enable you to do co-analysis of your programmatic data together with COVID-19 surveillance data and showing how outbreak surges are impacting routine service delivery. In the upper graph, HIV testing is represented in light blue and antenatal care 1 visits are represented in dark blue. Data from 2019 indicates that there's seasonal variation in HIV testing, which is consistent with other analyses we've performed. ANC1 access is generally consistent throughout the year. Again, just looking at the top slide. In the slide below, we look at 2020 data in which the first wave of COVID-19 pandemic hit, and we can see that there's a shift in delivery of essential services compared to the previous year. While ANC1, again represented in the dark blue, remains relatively constant and consistent between 2019 and 2020, you can see that HIV testing numbers show the anticipated peak around Q3, or month 3, I should say. But then the delivery of HIV testing remains relatively low without sort of the expected increase around September, which is month 9. Co-analysis of data like these can help us to identify geographic areas that are most affected by the pandemic and provide insight into where more resources may be needed in order to assure vaccine delivery. Next slide. So I'm going to turn it over to my colleague, Sam, who will talk a little bit more about our approach to time series and forecasting and how we anticipate this being useful moving forward as we continue to experience the COVID pandemic.
Thanks, Catherine, and thanks to all of AeHIN for allowing us to come and talk a little bit. I'm really excited to talk a bit about the topic of time series analysis and forecasting, and some work that we're doing using automated machine learning, which we'll get into at sort of a high level in just a little bit. We at BAO are closely tracking these emerging and maturing sets of tools to help automate and simplify common time series analysis processes. So things such as time series forecasting and anomaly detection, which I think are probably topics a lot of people on this call are familiar with, at least to a certain degree, even if they're not involved in actually doing those processes. And we do see a number of potential applications for these tools related to COVID-19 response and vaccine deployment. And we'll describe a couple of those in particular in relation to a proof of concept that we're developing. But these topics also apply to our routine data that we're collecting and utilizing and have been collecting and utilizing for many years. So just to make sure, you know, we're sort of using the same terms and that we all sort of have the same mental picture as we get into some of the more some more of the details, I do quickly want to touch on a few key concepts related to time series and how pervasive they are in a lot of the public health data that we work with. So on the screen now, we have an example of a time series, which, various definitions are out there, but I like this one from the OECD. It's a set of regular time ordered observations of some sort of metric taken over time, usually in sort of the same periodicity. So weekly, monthly, daily, something like that. And what we see on the screen here is actually a COVID-related time series that we're used to seeing now in the press and also in our daily jobs. So we've all become accustomed to seeing these, in particular related to COVID-19 lately. But whether we think about it consciously or not, we've all been working with time series data in public health for a very long time. DHIS2, which I'm assuming most of the people on this call are familiar with, started out its core aggregate data collection and analysis functionality is largely about visualizing and analyzing time series. There are mapping utilities as well, but I think a lot of that even came later on in the life cycle of DHIS2. So a lot of it was really about collecting and analyzing graphically time series data. I'm also assuming many people on this call are familiar with the WHO data quality assurance framework, which is about sets of tools and techniques to help ensure high quality data that we collect and use in public health and global public health. And one aspect of the framework is related to internal consistency, sort of making sure the data seem right over time and checking for outliers. And again, these are all time series analysis tools and techniques. And we are often trying to find new and innovative and useful ways in order to do such things as figure out the demand for our services in different locations, doing micro planning, and doing things like monitoring the rollout of both mass vaccination campaigns related to routine immunizations and to now increasingly the COVID-19 vaccine. So just to follow that up, here's a DHIS2 dashboard, and as we can see, what we're looking at is essentially time series data in various ways, whether it's tabular, year over year, or all along the time spectrum. And if you're not familiar with the WHO data quality assurance framework, there are at least 3 spots in it where it's talking about time series analysis. When we're looking at outlier detection using z-scored or modified z-scores, that's essentially a time series analysis technique. When we're comparing the values that we're seeing related to a 3-year versus a 3-year trend, again, we're looking at time series analysis. And if we start comparing the behavior of one time series compared to another indicator, so for instance, PMTCT, so the number of women who test positive for HIV during an ANC visit compared to early infant diagnoses, these types of relationships are also so co-analysis of indicators over time. So some of the key concepts, which I've already kind of mentioned, so we'll go over these quickly, but forecasting is an important process related to time series. It's been used, it has a long history for use in demand forecasting and things like that, and supply chain analysis, and also in forecasting the number of people who will have the flu each year, the seasonal flu. So forecasting is something that we're accustomed to, and it's a very important time series analysis technique. Anomaly detection is another one. Again, this is looking, thinking of that data quality assurance framework, looking for data that don't quite fit with the historical pattern for one reason or another. It can be because of data quality issues. It can be because we've introduced a new program which changes the way that our data are behaving because we're reaching more people. But this is a common task in time series analysis, is finding out when things are different, or when things have changed, or when things just don't fit with the rest of our data, for whatever reason that might be. And both for forecasting and for anomaly detection, it's often really important to get a handle on what the seasonality is within your data. So for data like these that we're looking at on the screen, we can see that there's sort of a repetitive pattern over time. We get a very high peak every fourth quarter. We get a smaller peak every second quarter, and these are real data taken from publicly available PEPFAR data. These are again PMTCT stat data from South Africa. These are the global figures for the last 4 or 5 years, and so we see seasonality there. And when we start trying to do forecasting or anomaly detection, it's often really important to account for this type of seasonality. And there are some simple techniques that can be used in order to do that. But one thing that I've noticed in looking at sort of the WHO guidance for the data quality assurance is I don't really see any mention of seasonality or how to control for it. And when we leave seasonality in the data and look at the raw data and apply some of the techniques, it makes it susceptible to a lot of false positives and a lot of false negatives. So even in the general guidance that's out there, there are some well-known aspects of time series that we're not really taking into account. And when we start talking about automated machine learning, one of the interesting things is these tools and techniques sort of are automatically able to adjust for seasonality and detect seasonality. So that's one of the main features of these tools. And similarly, time series data is often going to have a trend, whether it's a high trend or a large trend or a small trend, upward, downward, and of course they can change over time. So seasonality and trend are two important components of time series analysis that are very important to the activities of forecasting and anomaly detection, which are the things that we want to do. And when we get into talking a little bit more about automated machine learning for time series analysis, again, this is another aspect of time series that these tools can automatically take into account when producing forecasts or doing anomaly detection. So in thinking about some of the standard tools and guidance that are out there, so many times these tools are kept relatively simple, and for good reason, because then that makes it easier for them to apply. It's more likely that they will be applied, and oftentimes they are fit for purpose. So they do a pretty good job. But there are some limitations. So if we're not deseasonalizing our data, then we can end up with quite high false positive and error rates in forecasting, which erodes trust in these systems. Trends do not need to be linear over time, and a lot of the techniques sort of assume that they are. They don't necessarily use all of the available data that we have, or at least they don't use it efficiently. And oftentimes they are, unless you're bringing in an epidemiologist or a demographer who's doing some sort of a multivariate analysis, a lot of the times the tools that we're going to build into some of our e-health tools are going to be univariate, and we're losing a lot of opportunity to improve on anomaly detection and forecasting if we don't leverage additional data, whether that is data coming from a public data source that might be on the BAO Open Data Gateway, or from some sort of an internal system. So with that as a bit of background, so time series, we've all sort of done it, we've all seen it, we've all made decisions based on it. But at the end of the day, time series analysis can be a somewhat specialized skill. It does take people who are trained in the techniques and it also takes technical skills and operational skills to scale and monitor systems, forecasting systems that are put into place. So we've been, and so those are challenges in a lot of global public health. There's a shortage of analytical skill sets and data scientists. So at BAO, we really try to think of the big picture, and we're trying to, what I'm going to present here about automated machine learning isn't about being on the cutting edge or the bleeding edge. It's really thinking about how do we take these tools and how are we going to scale them, and how are we going to be able to apply them when we don't necessarily have extra analysts hanging around with nothing to do. So we're closely monitoring the availability and improvements in these automated machine learning tools specifically for time series forecasting and anomaly detection, because we see the potential here to reduce barriers to improving the time series analysis that we're doing in our processes, in our programs. So I'm gonna take a little bit of time on this slide, and in particular the very first one, because it's really important when I use the term automated machine learning and automated ML. It does sort of give this this idea of being potentially on the bleeding edge of technology, and that's really not what these are about. So when I say automated machine learning, I think at least specifically for time series analysis, the focus should be more on the automated part rather than the machine learning part of that term, because the way these tools work is they're going to take your data, your time series data, and they're going to apply a number, 5, 10, 25, 30 different time series analysis, time series forecasting methods to them. And they're going to start with the ones that have been used in industry for 50 years. So yes, they will scale up, and they will also try and apply the cutting edge deep learning types of methods, but it really runs the entire gamut. So these automated machine learning tools, I would encourage you to think about the automation that they bring to the party, maybe less than the fact that they do have machine learning and deep learning as some of the methods that they're fitting. So that's an important thing to keep in mind about these automated machine learning tools for time series analysis, is that they're a multi-method. The rest of the gamut here is largely about how they improve usability, and they make it possible for somebody who's not a software developer or not a data scientist to apply some of these tools. So as we've discussed, seasonality is very important, and these tools can either automatically detect seasonality, or they allow you to tell them, that my data are quarterly, my data are every second, depending on what type of data we're looking at. Many of them will provide facilities for preparing the data in the way that's required for the service or for the software application. And this can include giving you a set of options for how you fill in missing data, which is usually a pretty big problem for time series analysis. Usually you have to have a full set of data in order to run a lot of these techniques. And so these tools provide those data prep tools and provide these imputation options. Importantly, they are almost all, it's possible to provide multivariate data. So a lot of the historic, the forecasting techniques that have been used for 50 years, they're univariate. So you only look at the number of health services delivered of a particular type over time, and that's all you use in order to develop your forecasts. But we know that a lot of our data are related, And if we have an epidemiologist or if we have a demographer, they might be building multivariate models for prediction or for forecasting or something like that. And that's great if you have those people for whatever problem you're working on at any particular time. But when you don't, these automated machine learning tools provide that possibility to still be doing some multivariate analysis, to be able to do things like look at your early infant diagnosis for HIV data and make forecasts for that incorporate the historical data for the number of women in your PMTCD program who have tested positive for HIV. So the ability to sort of build multivariate models automatically is potentially very attractive if it leads to better outcomes for whatever you're trying to forecast. The tools also usually have a couple of options for how you interact with them, whether you interact with them programmatically or some sort of a graphical user interface. I'm going to show you some screenshots shortly of a tool that we've used called Amazon Forecast, which does provide both of those ways. So you can either upload your data just graphically through the Amazon Web Services console, or you can interact with it from a programming language. And importantly, some of the more full-featured and commercial services that are out there for automated machine learning, they also layer on top a lot of functionality related to evaluating the output from the machine learning process, from the automated machine learning process. So additional tools to help you analyze the errors and increasingly provide ways to improve the explainability of the models that are being produced. So again, those tend to be sort of some of the higher priced full featured options that are out there. But all of this feature set is sort of trickling down and becoming more available. So as I said, we've been keeping an eye on these different tools, and the list is growing of what's available for the different types of time series analysis techniques. I'll mention in a few minutes the work that I'm going to present shortly is we are working on a white paper for it that we plan to release, and that white paper will include a more detailed comparison of these different tools and what they do. So let's jump in now and talk a little bit at a fairly high level, but a little bit about this proof of concept that we've been working on. And really our idea right now is we're just trying to understand the potential for these tools. So our research question is really, do these AutoML based time series forecasting tools look like they can do something useful, and should we keep looking into them? But we needed to sort of frame that in a context and in a real use case. So what I'm going to present here is our attempt to use some of these AutoML tools to help understand service disruptions and the gaps that they cause in essential health services during the COVID-19 pandemic. And this is timely, this is relevant. We know that routine immunizations have been impacted by COVID-19, and this can lead to spillover effects and cause greater numbers of vaccine preventable disease. And an important activity related to dealing with this is planning catch-up campaigns. And as part of any vaccination catch-up campaign, the people that are planning have to have estimates of how many people were missed, how many people do they have to vaccinate, because first of all, those are the people who we sort of expected to show up in June and July, but then also, we might also have to vaccinate people that we would have expected to see in March and April and didn't, and they might show up in June and July. So we have to this is a forecasting activity. We have to have some idea about how many people we're going to expect. And ultimately, what we're looking at is trying to look at how many people we expected during certain months of the pandemic, and compare that with the number of people we saw in our services during that time period, and we're kind of interpreting the difference between those as a gap in essential services that might need to be closed. Importantly on this slide, again, in an ideal situation, we would already have a target, we would already have a forecast, maybe from a model that an epidemiologist put together for us. So we might already have a credible target, and we might already know how many people we think we missed. So that's the best case scenario, but in many cases we don't have that. And we definitely might not have that at a micro level, which is where we have to do the planning at a site and facility level. So then the next best approach with this guidance that we're looking at is basically to use last year's value for whatever service for whatever vaccination we're looking at, and sort of carry that forward and use that as what we should have expected this year. And so a technique like that, first of all, it's easy to apply, so that's good. It's in this documentation. You can see similar things elsewhere. It is also used in industry. So it's in a well-accepted approach, and it's often going to be fit for purpose, but not always. And just looking at that guidance and what we've already discussed, it's not going to account for any sort of trend if we just follow that guidance the way it's written. It does sort of adjust for seasonality because we're looking at the same period from the previous year, but we're relying on just 1 year of data. So we're not really using the richness of the data to estimate that seasonality, and we're not bringing in any additional information in order to do that analysis. So talking about the proof of concept that we've worked on at really quite a high level. Again, we are going to be releasing a white paper along with the resources and the data that would allow you to reproduce, or someone on your team to reproduce the study if they wanted to. But at a high level, we basically took some publicly available PEPFAR data, and we selected one of the indicators, PMTCT stat, which is why I've been mentioning it over and over again throughout this presentation. We took that data, we did some cleaning of it, and we fed it to one of these automated machine learning processes to get forecasts for PMTCT stat figures for April and September of 2020. So in the early quarters, I guess, of the pandemic. So we generated those forecasts, and then we compared that with sort of the benchmark method, which is what I just mentioned, sort of looking at the same data, the same indicator from the previous year, and using that as our forecast. So that's kind of the benchmark. That was what was in that WHO guidance. So that's what we're going to use as our benchmark. And we compare that and see which one does a better job predicting for April through September of 2020. And what we'll show is that we found the automated machine learning process does do better. And we'll show you those statistics at forecasting sort of on average. And so then we'll look at taking that forecast and comparing it with the actuals and interpreting that roughly as the gap in services that we weren't able to deliver in April and September. So again, the data are publicly available from PEPFAR. We use one single indicator. And importantly, so because this is really an initial proof of concept, we really had to kind of scale down what we were doing in order to get it done in a reasonable time frame. So we're only looking at data that have a full history of data from what would have been fiscal year 2016 through fiscal year 2020. So we've already simplified our analysis quite a bit, sort of deviating from something that would be actionable at this stage. So with that in mind, I do want to be very clear. This is an initial proof of concept. At this stage, we're not ready to recommend that you try and incorporate these automated machine learning tools into your COVID-19 response, but we think it is worth looking at them. And importantly, what I'm going to show you on the next couple of slides related to an example of estimating essential service gaps. These are just illustrative examples. They shouldn't be taken as something that that would actually be used by, don't call your friends in South Africa and tell them you've learned all this stuff about their PMTCT stat program. So what I'm going to look at here, what we're going to look at here is a subsample of this the South Africa data that we were looking at. So you can see that we've already sort of, the time series looks quite a bit different. So we've already simplified from reality a fair bit in the sake of moving this proof of concept along. So taking this data, so what we're looking at is a visualization that was produced with Power BI. And if you're familiar with Power BI, you might know that it actually has sort of some forecasting capabilities. So the what we see here was produced entirely in Power BI. And we can see basically that we did a forecast, that black line in the last two periods. So that's April through September of 2020. The black line is a forecast produced by Power BI. The gray area is the prediction interval. And already just looking at this at the country level, we can see that the blue line, which is the actual PMTCT stat values for our subsample, not only is it below the forecast value, but it's also below the 95% confidence interval. So it does look like at an aggregate level, PMTCT services were disrupted during that period. Having that at a country level and looking at it at a country level doesn't necessarily help us with any sort of micro planning. What we really want to do is get down oftentimes to the site level, or at least the district level, to do some of this analysis. And we're not going to use Power BI and click through 15. I think in this case, we have 1,700 sites that I'm analyzing. We're not going to look at each one of these. We have to figure out how to automate this and potentially how to improve the forecasts that we're getting out of it. So what we see on the screen now is the interface for Amazon Forecast. And there's a little bit of data prep that has to happen, and we have to upload the data to the right spot. But we can get forecasts out relatively easily with a little bit of point and click. I mean, you can see on there, I've basically just selected AutoML, and I told it what sort of predictions I want and a little bit about the data, and I've had to upload the data. But at the bottom of that last screen, there's basically a button that says go. And then it'll go up, it'll go off for 2 hours. The service will go off for 2 hours and fit a bunch of different time series forecasting models. And it will calculate accuracy statistics for it. And it will figure out which one fits. It shouldn't say which one fits. It will figure out which one does the best at predicting out of sample on the data that we've provided it. And then it'll give you the summary of the accuracy statistics. And you can click through and actually look at the different methods. So what I see on the screen here, it says, Deep AR Plus was the winner, but that little drop down, you can click through and see all of the other methods that are part of the automated machine learning process. Here we see the summary of what we got out of the sort of the accuracy metrics of what we got out of our benchmark approach, so the one that was sort of more or less similar to what the WHO guidance had related to vaccine catch-up campaigns. And then on the right, we have what was selected by the automated machine learning process as the best method. And this happens to be a deep learning type of model. And neither one of them is necessarily forecasting what we would love to see. But if you look at that average line, essentially the benchmark method is making forecast errors. This is roughly can be interpreted as average percent error. So it's about 24% off, plus or minus, comparing the actuals versus the forecast, versus about 19% for what we get out of the automated machine learning process. So yes, without too much effort, we were able to utilize one of these automated machine learning processes and get forecasts that on average seem to be better than the status quo. So now taking that, and applying it to our theoretical problem, now we have a forecast and we can compare that with the actuals. And so I've plotted those together on this line, and we can see that there's about an 18,000 woman gap between what we would have expected based on our forecast and what we actually delivered in that would have been Q4 2020, fiscal Q4 2020. And this looks a little bit like what I showed you a few slides back that I produced just directly in Power BI without using some automated machine learning process. But again, remember what we're looking at here is aggregated from site level prediction. So we actually created a prediction for every single site in South Africa that met our criteria for inclusion in the study. So we actually get gap down to the facility level. And that's not something that we're going to get out of, clicking through Power BI visualization. So when it comes to scaling, these types of tools really have a lot of potential. So that's a very high level look at the proof of concept. Reach out to us if you find it interesting, and we'll be sure to get you a copy of the white paper and the other resources when they are available. For sure, there's a lot of details to work out to be able to operationalize this or operationalize something like this. But we are really excited about the possibilities. And so here are some thoughts on the screen where we think tools like these could be utilized. And I'm going to single out the one at the very top, because I think this is an area where it's kind of low-hanging fruit, and it's related to the vaccination campaigns that are going on now related to COVID-19. We need to have good data to know whether we're reaching 85% of the population, 90% of the, so we need coverage data. We need good data about waste management, things like that. And we mentioned that many of these tools provide for anomaly detection. And so I do think bringing these tools in and thinking about whether they can be applied to improving the data quality throughout these campaigns is low-hanging fruit. And in particular, because there is some black boxiness to some of this, which can be problematic. At least with data quality and with anomaly detection, there's always a human in the middle, right? So these tools might flag a problem, but ultimately somebody has to look at the data and determine whether or not there really is a problem and possibly diagnose it and correct it. So that's really an area where I see a lot of potential to apply these techniques soon, the next 6 months, the next year, as we're running these COVID-19 vaccination campaigns. So I'll leave it there, because I also want to hear your thoughts, and Catherine does as well, on these ideas and where you think they might be applicable. So thank you very much, and I'll turn it over to whoever handles the Q&A session.
Yes, thank you, Miss Kathy and Sir Sam. There are a few questions from our participants. The first one is from Dr. Alvin. So he's asking how BAO systems evolved since the last webinar last year, and what effect did the pandemic have on your roadmap?
Catherine, do you want to field that one?
Yep. Yep. I think certainly with the pandemic, I mean, we've been lucky in that a lot of our work has maintained, definitely slowed down, as a lot of our partners have been redirected to supporting COVID effects, the COVID pandemic and the COVID response. And so certainly, you know, things that we had planned originally weren't necessarily completed as we thought that they were, but a lot of the work has really been trying to focus on how we can help our partners better understand the impact of the pandemic on their own services. And I think that this has certainly brought to light the value of data use. And I think being able to do surveillance, disease surveillance and early detection systems, and has certainly amongst our partners has increased the value of data. And so a lot of the ways that we've been able to support our partners is really help them think through how they're currently analyzing their data and helping them to understand what gaps in services have been occurring.
Thank you, Miss Kathy. The next question is, are the data in BAO exportable for opening and other applications?
Yes, so currently with the BAO Open Data Gateway, users, we basically will have a URL where you can go and register, and that will give you free and open access to all of the data that's contained within the Open Data Gateway. And there is a download button, so you are free to download any of the data. Currently with the free service, we aren't allowing sort of any API direct calls to it, but the data are downloadable.
Thank you, Miss Kathy. The next question is, what's the minimum dataset size for AutoML analysis? And the AutoML seems maybe too complex for most ministries of health. So are you releasing it as an algorithm as a service?
So again, these AutoML processes, they start with the simplest, although often very good, univariate methods. So in theory, although I haven't tried this, in theory, you could submit one single time series because it will fit exponential smoothing and it will fit ARIMA, and you know you would be able to get a comparison of how it fits to that single time series. And there are R packages and Python packages too that can do this, the fitting of these models. So technically, there's no minimum size because of the range of methods that they try out. And as far as the AutoML being too complex, these already are services. So these are services that are provided by AWS, by Azure, by other providers. So they already are sort of software as a service or algorithm as a service or automated machine learning as a service. Our objective is, you know, we really are trying to think about scaling and how these could be applied by, let's say, somebody who's got a BI profile. So that's a business analyst or a business intelligence analyst profile. So, you know, obviously, if you know, if you don't have the available capacity, then there are organizations like us who can help. But we really are thinking about how can these be applied by ministries of health or by in-country consultants and things like that as well. So you know, you can get you can get quite a bit of mileage, I think, with your current staff. But we would certainly be more than happy to help if you're interested in these things and you need you know, additional consultancy.
Thank you for that, Sir Sam. Our next question is from Dr. Binji. So, when you say anomaly analysis and detection, is this just based on predictive statistical models, or are there already some artificial intelligence and machine learning measures incorporated in the system as part of that larger data analytics and time series analytic techniques?
Yeah, so I mean, there are a number of different anomaly detection techniques that are applied, but to a large extent, the way these work in one way or another is anomaly detection in the case of time series is a bit of an extension of forecasting. So ultimately, you're trying to there will be some sort of a forecasting type model that is developing an expectation of what values should be and what the range of values would be, and then there's some sort of a test on whether it's within or without what are expected boundaries for what we would expect. So yeah, there are forecasting techniques built in under the hood, whether they're machine learning based, artificial intelligence based, or simpler forecasting methods.
Thank you, Sir Sam. There's another question from Dr. Alvin. Machine learning techniques are becoming popular, so should they be subjected to peer review or should they be treated as black boxes or proprietary?
I think that's going to depend on the situation. So I'm certainly I'm certainly leery myself of things that are black boxes, especially depending on what the problem is. So a black box that tells us this many COVID vaccines should go left and this many COVID vaccines should go right is probably going to be problematic. Which is why I think the initial steps that we might want to look at for applying these types of tools is in data quality, because there basically has to be a human in the loop. So it's not really about decision making, it's about augmentation. But anytime you start utilizing these tools to make decisions, there's an additional layer of scrutiny. And I think the general data science and AI and ML profession understands that, and that's why you're seeing more and more emphasis on the explainability of models and trying to allow users to understand how a decision was arrived by a particular algorithm. So black boxes are scary when they make decisions, for sure. But that doesn't mean that there aren't good spots where we can use automated machine learning, and even if it's a black box. I hope that answers the question.
Yes, thank you, Sir Sam. So we have our last two questions for this session. So the first one is from Dr. Julius. In analyzing country-level big data with the potential for data lag of days or weeks, would you recommend cumulative aggregation techniques when reporting time series data?
So I'm not 100% certain if I'm interpreting this question right, but I think you're asking, should we aggregate up in order to do the time series analysis? And sometimes that makes sense. You can certainly do the analysis at both levels and see. It really depends on the problem that you're looking at. But at the end of the day, anytime you start aggregating, you are losing some granularity and you're losing some information. So that's, in the example that I provided, we did actually do the forecasting at the site level and then aggregate it up to analyze our output. But it really is going to depend on exactly what your objective is for doing the time series analysis. So the higher you aggregate, sort of the smoother your data are often going to be. So you might get a better fitting forecast, but if what you want to do is micro planning, that's not going to help you.
Thank you, Sir Sam. The next question is from Dr. Jong. How does bias figure in this AutoML forecasting?
So I mean, that's not really something that we have addressed here. Ultimately, bias comes from the data that you feed to whatever algorithm you're looking at. I think if we're just talking about this study that we've done, we did filter the data, but the idea is that we would use the entire universe of our health data. And so the forecasting shouldn't exhibit bias. But if you start sampling your data and the sampling process, if you start sampling the data that you feed to the algorithm for doing things like distributing COVID-19 vaccines, and that sampling process is biased, then your forecasts are going to be biased as well. So ultimately, it gets down to is your data representative for the task at hand, and if not, then you might need to collect more data. I think the risks here are a little bit different than, say, bias in image recognition and things like that, because we have a lot of the data that we're working at, we at least at the country level, at the MOH level, we have all of the data for the country in the types of problems that we're looking at here. So bias, I would think, would be less of an issue in these applications.
Can I follow up on that question? Is it okay?
Yeah.
So in a lot of AI ethics circles now, so there's explainable AI and transparent AI, and frameworks have been considering the side-by-side evaluation of bias along with the forecast, just sort of to evaluate whether or not the forecast is correct. So you're right. If the data is biased, then the forecast is biased. So that you have to have a side-by-side evaluation of the data bias in order to determine, or at least to have an idea whether or not the forecast is fair.
Yeah. I think you agreed with me. if not,
no, I did agree with you. Agreed,
yeah,
but
okay.
I do not see any data evaluation or assessment ahead of the forecasting in this, I guess, in this platform or in this automated ML. So all I'm saying is, so where is the data assessment that should go side by side with your forecasting?
Yeah. So I mean, at that point, that's where you do need analysts and people who are organizing and prepping the data to have some understanding and some sensitivity to this. And then also, if there is, if the people who are applying these techniques do think there's the possibility of bias, then hopefully on the back end, they are looking at the tools for explainability and trying to understand if bias has crept into their analysis.
And it can be automated, correct? Just like AutoML. I mean, bias assessments.
Perhaps I'm not sure. That is definitely not part of these tools that I've looked at up to date. Other than the fact that some of them include explainability on the back end.
Sorry to break this. I think we have a very interesting thread, but we have another meeting using the same room. So I think Professor Jong, you can communicate with Sam offline. There's an email address. I think we should have another session on AI ethics because there's a lot of interest on the topic. So thank you to Kathy, Sam, BAO Systems, and all the participants in the call. We've reached the top of the hour, but I think there's a lot of interest on AI ethics, so we'll hope to have another one. We will also we also invited the other systems that had presented their technologies last year to have a review of what happened since the pandemic started. So thank you, everyone. We'll see you in the next AeHIN webinar. Thank you, Professor Jong, Sam, Kathy.
Thank you for
Thank
having
you.
us. Bye.
Thank you.
Bye. Thank you.